If the nose you were born with makes you self-conscious or unhappy, you don't have to live with it. You can do something you don't have to live with. Rhinoplasty. You can do something about it. Discuss today. Rhinoplasty is what we're going to discuss today. It's nose reshaping. To give you an aesthetically pleasing nose without dramatically changing the world. Here to give us the details on that is Dr. Jason Leedy, who is a plastic surgeon at the Dr. Jason Leedy, who is a plastic surgeon at the Cleveland Plastic Surgery.
How would you describe the goal of rhinoplasty today? Describe the goal of rhinoplasty today.
The nose isn't meant to be the focal point of the face.
The nose isn't meant to be the focal
point of the face.
You want someone to
look at your eyes.
You want someone to
in your overall face and not be distracted by
in your overall face
and not be distracted by an unsightly feature. So
the goal of rhinoplasty is
to really take the
unattractive aspects of the nose
and just remove them.
And leave someone with a natural nose that's appropriate for their face.
And leave someone with a natural nose that's appropriate for their face.
Making it so that it's an aspect that you don't really pay attention to.
And you look at their eyes.
That you don't really pay attention to.
And you look at their eyes.
Well, who can have this kind of a procedure?
And anyone, once they're fully grown.
Anyone,
usually that means
at least
16 years of age.
Usually that means
at least 16 years of age.
Into the
60s or so.
Up into the
60s or so.
Of the kinds of things that can be done. Let's take a look at some of them. Let's take a look at some of them now.
This patient, she was unhappy with the fullness in the lower aspect of her nose.
Was unhappy with the
cartilages there were a little overgrown,
and
the cartilages there were a little overgrown,
and she wanted to have a more refined feminine shape to the nose.
She wanted to have a more refined feminine shape to the nose cartilages.
In her surgery,
took away that
those cartilages
and
leaving a natural
took away
shape.
that fullness,
but leaving a natural shape.
This is the same patient, and she also had an overprojecting tip,
and she also
fullness
had
to the dorsum,
an overprojecting tip,
some fullness to the dorsum,
reshaped as well. Again, the goal being not to create a characteristic.
Again, the goal being not to create a characteristic,
but a natural look
that's operated on
that's
look,
pleasing
but
and
appropriate
natural
for her face.
That's pleasing and
this is
appropriate
another
for her
patient.
face.
Now she had a similar issue. The tip somewhat bulbous. Had a similar issue. The tip somewhat asymmetric. And she was looking for a more refined, unified, and she was looking for a more refined, feminine, attractive shape. And so the goal here was to reshape the tip, make it a little smaller. And you can see it's a subtle change, make it a little dramatic. And you can see it's a subtle change. You wouldn't know that she had surgery. And one that you wouldn't know that she had surgery. The tip you can see. Same patient again from the side. Slightly the tip you can rounded. It doesn't have the distinct features that make doesn't have the distinct nose, and in her surgery that was reshaped for an attractive nose, and in her surgery that was reshaped.
The tip of the nose.
Now this
those two are more about the tip of the nose.
The characteristic, the dorsum is too big. The characteristic,
and she had the dorsum
taken down, and she had
creating
a more attractive
taken down
shape to the
creating
nose,
a more attractive shape to the nose.
Afterwards.
Now, does this procedure require a hospital stay? Does this procedure require
the surgery
a hospital
is
stay?
done as an outpatient, meaning that they go home. The surgery usually takes 2 to 3 hours. They go home.
There's a
surgery usually takes 2 to 3 hours, and that splint is on for 1 week. There's also some sutures that is on for 1 week. There's also some sutures those are removed at a week. And at the base of the nose, those are removed at a week. Someone comes back to the office. The sutures are removed. Someone comes back to the office, and they can see the result right there and then. It does take a few months for the swelling to subside, but it does take a few months for the swelling to subside. But quite rapidly. The dramatic result is seen.
There's no major aftercare issues. So there's no major aftercare issues.
Generally, no. Just 24 to 48 hours of a little drip from the nose. 24 to 48 hours of a little drip from the nose, and we'll have the benefits. And
if someone is pondering this for themselves, what should they do for themselves?
Well, I recommend visiting a board-certified plastic surgeon. Visiting a board-certified plastic surgeon and to discuss the options available and to make sure that they are receiving the information that make sure that they are receiving the information that they need.
I've known elder people who
veins breaking down their nose, and their nose gets too large. Veins breaking down their nose, and their nose gets too large.
Absolutely, that's a condition called rhinophyma, and that's a condition called rhinophyma, and that's a slightly different issue. Overgrowth of the nose, and insurance may cover part of that. That involves insurance may cover part of that. That involves basically removing that overgrowth of
people can get in touch with you, and I'll give the telephone number that you can call, and I'll give the Plastic Surgery Institute, and it is 440-461-6100, and there's a website as well. You can see a lot and learn a lot. And there's a website as well. You can see a lot and learn a lot by going to www.drleedy.com. Thank you very much.
Thanks for having me.
Nice to have you here. Thank you very much.
Thanks for having me.
Nice to have you here.
We'll be back in a moment.